What does sleep have to do with your heart? Doesn't seem to be related, but Dr. John Osborne's here today to help us connect the dots and understand how sleep affects your heart. Thank you for joining us here.
Thank you, Scott.
Why is breathing important to the heart? Well, we know air goes into the lungs. What's taken out of air that's so vital to the heart?
Oxygen.
And oxygen goes into the lungs straight to the heart. What does the oxygen do for the heart?
So the oxygen allows the heart to work. Without oxygen, the heart does not work.
And if you starve the heart of oxygen, what happens to it? What is something that could happen to the heart when it doesn't have enough oxygen?
The heart can develop irregular heart rhythms. The heart can begin to panic, if you will, contributing to things like high blood pressure. So those are some of the things that occur when we're not getting enough oxygen to the heart.
So when you think of sleep, what happens in sleep is people as they go into deeper levels of sleep, their body relaxes and their airway can actually get blocked off, can it?
No question.
And that's called?
Sleep apnea.
Sleep apnea. Now what's the word apnea mean?
Stop breathing.
Stop breathing, which drops the oxygen level.
Right.
So the first connection is between sleep and the heart is that when your breathing tube collapses, you could damage the heart muscle. Now, if I'm a patient and I'm coming in to see you, what are some symptoms or signs that I may have a sleep problem that would give you concern, maybe causing me to have apnea without breathing?
You know, it's fascinating. No one comes to me saying, I snore all night. Now, their spouse may tell them they snore, their husband, but no one comes to me saying, I have sleep apnea. It's usually the spouse or companion. What they do complain about is fatigue. I'm tired, I wake up in the morning, I got a dry mouth, I'm falling asleep while I'm driving, I'm falling asleep during the day, I'm falling asleep at meetings, and it's a pretty miserable life.
So not enough energy during the day. Your spouse complaining about snoring at night, but a third of us sleep alone if you're single or haven't gotten married yet. So that, and then if someone has arrhythmia diseases, do you sometimes think of it?
Absolutely. One of the clear rhythm problems that's associated with this condition is something we call atrial fibrillation. And what we saw, and we've known this for many years, is that people develop this rhythm at night.
Aha. So people are getting atrial fib at night, discover a sleep problem, and all of a sudden we understand there's a close relationship there.
Right.
Now, if you fix the sleep, can you help with the atrial fibrillation?
Yes.
That's great.
In fact, when we have patients with atrial fibrillation, many times we will actually do a sleep study to see if that's what's the trigger for the atrial fibrillation.
Wow. Are there any other diseases that make you think, wow, this person's at a much higher chance of having...
The other condition is high blood pressure.
High blood pressure?
We know not only in people who have sleep apnea do they tend to have higher blood pressure, but if you take people with high blood pressure and sleep apnea and you treat the sleep apnea, the blood pressure gets better.
Fantastic. What about diabetes? Is there any relationship there?
No question. So diabetes is a complex disease, but one of the things that triggers it is stress on the body. And when we don't sleep and we don't get restorative sleep at night, produces a huge amount of stress in the body, and that is one of the things that can trigger diabetes.
What about heart failure? Is heart failure related to sleep at all?
Yes. So when the heart doesn't get enough oxygen, because your breathing tube collapses, stress on the heart begins to fail.
Wow. So atrial fibrillation, cardiac arrhythmias, congestive heart failure, diabetes, hypertension. I guess that's a big part of what you do.
Pretty much the spectrum of cardiology.
And
that's why understanding what used to be that black box, that third of our life that we just never even thought about, is so important. And that's what sleep studies and understanding sleep really can add further to appreciation of patients with heart problems.
So if I have one of those problems, what's my next step?
The first step, do I have the problem or not? And what's interesting is people with sleep apnea, again, their spouse may note that they stop breathing at night or gasping or snoring, but I'll tell you, there's lots and lots of people that they don't sleep with somebody. In fact, they may have been kicked out of the bedroom because that occurred, or else they just don't manifest those symptoms. But not having those kind of symptoms at night doesn't mean you don't have sleep apnea. So you really just need to do the test, and the test is a sleep study. A sleep study.
So during a sleep study, are they watching my heart?
Yes. During sleep study, they actually kind of wire you for sound. They're looking at breathing, looking at oxygen levels, they're looking at heart rate, heart rhythm, looking at chest expansion, looking at motion of the legs, etc. And this allows us to see exactly what's going on at night when you sleep.
A lot of patients are worried about having somebody sit in the room and watch them sleep. Is that the way this happens?
No, no one's sitting in the room. You are monitored. They use discrete little monitors and video, but these sleep centers they look like any hotel room.
Oh, so it's kind of like going to a hotel, spending the night, but you got some wires on you.
Exactly.
Some patients say, oh my gosh, I'll never get to sleep.
I'll tell you what, that's usually never a problem.
Particularly, I guess, if they have a sleep problem, they're usually kind of tired when they lay down.
No question.
All right, so do you send people for sleep studies?
Yes.
And can you tell me a story of a patient that you sent for a sleep study and you found something that made a difference in how you treated them?
Oh, sure, many patients. You know, I think many patients of mine with atrial fibrillation, with high blood pressure, with heart failure, whom they were tired, fatigued, and we suspected they had sleep apnea. We sent them off for sleep studies, and they're markedly positive.
Wow.
And as we treated them, it's amazing. They came back, they felt better, their fatigue improved, they felt themselves, and it's really a wonderful thing to see.
Thank you for being here and sharing that link between sleep and heart disease that most people don't even realize exists.
Thank you, Scott.
And I hope those of you who are watching CVTV today will take the time to look at the questions. You can go to sothcardiology.com. There's a sleep questionnaire on the site that you can look at that will help you know whether or not you may need to go to a doctor, to Dr. Osborne as an example, and get a sleep study performed. Thank you for being here with us today.